This is Tanya Stansel with Health Education Services. We will discuss sickle cell disease. This video is for educational purposes only. It is not meant to diagnose or treat any condition. Sickle cell disease is a group of disorders that are inherited and affect red blood cells. It is inherited by both parents passing a sickle cell gene to the child. Normally, red blood cells are round, smooth, and can bend. Because of these qualities and the presence of hemoglobin, red blood cells are able to carry oxygen within blood and travel well in blood vessels. The sickle cell gene causes the red blood cell to change shape and to look like a sickle. The change in the shape of the red blood cell causes it to not be able to bend. This lack of flexibility causes the red blood cell to block blood vessels and get stuck. Their decreased ability to travel in blood vessels affect their ability to deliver oxygen to the body. The change in shape also affects the length of time that they are viable. Typically, red blood cells remain in the body for up to 120 days. Sickled red blood cells only remain in the body for 10 to 20 days. The shorter life of sickled red blood cells causes an individual to suffer from chronic anemia. Additionally, as they are filtered through the spleen, which filters the blood and is important in the immune system, they get stuck and damage the spleen. The damage to the spleen causes someone to be at an increased risk for infections. There are several types of sickle cell disease. The most common is sickle cell anemia or hemoglobin SS. With sickle cell anemia, an individual has inherited two sickle cell genes, one from each parent. This is the most severe form of sickle cell disease, as symptoms occur more often and are more severe. Other types of sickle cell disease include hemoglobin SC disease, where the individual inherits a sickle cell gene and an abnormal hemoglobin gene C. This form is milder than hemoglobin SS or sickle cell anemia. Hemoglobin S beta thalassemia. This individual inherits a sickle cell gene and a beta thalassemia gene. There are two types of beta thalassemia, positive and zero. Hemoglobin SB plus is a mild form of sickle cell disease. Hemoglobin SB0 is a severe form similar to sickle cell anemia. Hemoglobin AS, also known as sickle cell trait, is where an individual inherits one sickle cell gene and one normal gene. There are usually no symptoms of disease. Symptoms typically begin with the first year of life. Symptoms and complications of sickle cell disease include fatigue, fussiness in babies, bedwetting due to kidney problems, jaundice, hand-foot syndrome, where there is swelling and pain in hands and feet, and is also accompanied by fever, frequent infections. There's an increased risk of infection, especially of bacterial infections due to splenic damage. A leading cause of death in infants and children is pneumonia. Acute chest syndrome, where there is chest pain, coughing, difficulty breathing, and fever. This can be life threatening. Anemia, which is due to the red blood cells dying after 10 to 20 days. Delayed growth or puberty. Vision issues, which is due to sickle cells blocking blood vessels in the eyes, damaging the retinas. Pain crisis, which is due to sickled red blood cells getting stuck and blocking blood vessels, causing sudden, mild to the severe pain. Splenic sequestration, which occurs when many sickle cells get stuck within the spleen, causing it to enlarge. This enlargement causes sudden weakness, pale lips, fast breathing, extreme thirst, abdominal pain, and fast heartbeat. Leg ulcers, stroke, which occurs when sickle cells block blood vessels to the brain. Deep vein thrombosis and pulmonary embolism, which are caused by sickled cells contributing to blood coagulation and increased risk of blood clots either in the deep veins or the lungs. Gallstones. The increased rate at which sickled red blood cells die cause increased byproducts that form gallstones. Pregnancy problems. There is an increased risk of hypertension and blood clots during pregnancy. Approximately 90% of those diagnosed with sickle cell disease in the United States are of African descent, with about 1 in every 360 individuals of African descent being affected and 1 in 13 having sickle cell traits. In order to be diagnosed with sickle cell disease, a blood test must be done, which is typically done as one of the screening tests done with newborns. Blood tests can also determine the type of sickle cell disease. There are several treatments for sickle cell disease, including medications such as voxelotor, which prevents the sickle shape, crizanlizumab, which is used to treat praying crisis, penicillin, which decreases the risk of severe infections, particularly by pneumococcus bacteria, hydroxyurea, which decreases complications and should not be used during pregnancy, and L-glutamine oral powder, which decreases pain crises. Hydration helps to keep cells from deforming. Regular exercise and reducing stress helps to reduce pain crises. Transfusion help to treat and prevent complications, and blood and bone marrow transplants are the only cure for sickle cell disease. They are risky in adults, and individuals must have a matched donor. Thank you for joining us today. To learn more about sickle cell disease and other health topics, go to our blog at healthylivingforyourself.blogspot.com.